All right, our next item is a report by Kevin Matthews on the Psilocybin Decriminalization. Apparently, I can't say either of those words. Oh, Psilocybin, thank you. Paul Cashman for telling me how to say that word. Kevin Matthews, welcome, and we will let you take it away.
Thank you, Madam Chair. Just going to pull up our presentation here.
We will get that power
Got it.
up for you.
Thank you. Thank you, Zach. You said you'd escape. Beautiful. Thank you. Excellent. Madam Chair, esteemed council members, my name is Kevin Matthews, and I am humbled, honored, and very privileged to be sharing this comprehensive report with you today, both as the president of the Denver Psilocybin Mushroom Policy Review Panel and as a proponent of Initiative 301, as many of you know, which passed in May of 2019 with more than 90,000 Denver voters. And today with this report explains why earlier this year in March of 2021, our Psilocybin Mushroom Policy Review Panel unanimously declared that decriminalizing psilocybin mushrooms in the city and county of Denver has not since created any significant public health or safety issue in the city, and that we should, among other recommendations, train all of our city and county of Denver first responders on psychedelic crisis intervention, and also expand civil liberties with psilocybin mushrooms in the city and county of Denver. And so we'll run through this presentation as quickly as we can today. And briefly, our agenda is that we'll share a little bit of what we learned since May 2019 and since our panel was convened in February of 2020. We'll discuss our multi-responder training. We'll share details and data around arrests, safety, and psilocybin use in the city. And then we'll share all of our recommendations that our panel will be making and is making to the Denver City Council. And then we'll finish it up with our conclusion and talking about next steps. So what we've learned. We know that psilocybin mushrooms have been used by cultures across the entire world for millennia. Archaeological evidence indicates that psilocybin mushrooms were used by human cultures dating as far back as 9,000 BCE. And psilocybin mushrooms grow on every single continent except Antarctica. Now, although psilocybin mushrooms, we believe, are common to humanity, the current resurgence and revival in the West very much owes a debt of gratitude to Maria Sabina, the woman pictured here. Maria Sabina was the first Mexican curandera, or healer, who allowed Westerners to participate in her purification ceremony known as a velada, or ritual, involving Los Santos Niños, or the little saints. That's the term that she used for psilocybin mushrooms. Now, this entire movement, from the grassroots policy reform movement that we've seen sweep the nation over the last few years, to the clinical research, to the emergent psilocybin ecosystem and industry, owes this debt of gratitude to Maria Sabina. And Maria not only inspired an entire generation of individuals to find healing, explore their consciousness, and reconnect with nature and the divine, but her work also inspired early university-level research in the 1960s, which at the time was clearly indicating and suggesting that psilocybin may actually have a therapeutic potential. Now, despite prohibition, that early university-level research paved the way for modern, double-blind, placebo-controlled clinical trials here in the US and other parts of the world, where these clinical trials over the past 2 decades have been demonstrating psilocybin's efficacy as a powerful potential treatment option for things like major depression, anxiety disorders, substance abuse disorders, alcoholism, nicotine addiction, and other things. Now, even as recently as both in 2018 and 2019, psilocybin mushrooms received breakthrough therapy status from the FDA for the treatment of treatment-resistant depression and major depression, respectively. Now, in addition to the last 2 decades of clinical research, our work in Denver, when we passed Initiative 301 2.5 years ago, catalyzed and helped inspire a national grassroots movement to decriminalize psilocybin and other naturally occurring psychedelics. So in addition to the clinical research that's been conducted and our work in Denver, we know beyond the shadow of a doubt, so given that there's a national revival with this movement right now, and considering that the city and county of Denver is already reimagining drug enforcement policies with programs like our mental health co-responders unit and our STAR program, and recognizing there's so much more of a national interest in this movement, one of the first things that we asked ourselves in our panel was, what can we do here in Denver to make a tremendous impact that is prioritizing the safety of our city and county of Denver residents? And so with that, I would like to introduce my colleague and good friend, Sarah Gale, to discuss our multi-responder training.
Thank you, Kevin. Good afternoon, council members. While psilocybin and other classical psychedelics are considered physiologically safer and less habit-forming than many other psychoactive substances, some users can experience adverse psychological or behavioral responses. While the vast majority of psilocybin users experience little to no adverse effects of a routine dosage, a small percentage respond adversely to the substance. And adverse effects may be substantially worsened in people with pre-existing mental health issues and are those who consume large doses, as well as first-time users. Many adverse incidents and crises related to psychedelics can be prevented by increasing public education and awareness around the importance of set and setting and preparation, as well as integration after an experience, as well as providing tools and knowledge that increase the likelihood of safer use. In addition to advancing this training initiative that I will be discussing today, the panel will concurrently put forth recommendations for public education and public service announcements that encourage learning so that many people may make more informed and responsible decisions regarding psilocybin use. The panel recommends specialized harm reduction training for City and County of Denver first responders that focuses on effective approaches to de-escalating psilocybin-induced psychological or behavioral crisis events. In May of 2020, the panel formed an internal psilocybin harm reduction working group, which included members of the panel who specialize in mental health, harm reduction, substance use, and law enforcement. That might be a good moment to introduce myself. So I am a licensed professional counselor, and I sit on the panel as the harm reduction advocate, and I'm also the harm reduction officer at the Multidisciplinary Association for Psychedelic Studies, so otherwise known as MAPS. The panel voted in September of 2020 to collaborate with MAPS, a psychedelic drug research, education, and harm reduction organization founded in 1986, on the development of a psilocybin harm reduction training. So over the past 5 years in the United States, emergency response to psychedelic crisis has resulted in wrongful death suits with an average settlement amount of $2.28 million. Lack of appropriate response to psilocybin-induced crisis may result in personal, career, and financial consequences for cities and their staff that can result in liability and adjudicated costs for damages associated with improper response. Standardized appropriate response protocols, training, and infrastructure do not currently exist for response to psilocybin crisis. Appropriate responses to psilocybin crisis differ from responses to common substance-induced crisis arising from things like alcohol, opioids, and methamphetamine use. Where available, crisis intervention response training typically does not include response to psychedelic or psilocybin crisis. The training program that we have initiated will provide law enforcement, including Denver Police Department and Denver Sheriff's Department, emergency medical services, and mental health co-responders with knowledge and information to close gaps in current training. Denver is already leading the way in a lot of training programs for these emergency service departments, and was one of the cities that adopted the was an early adopter of the crisis intervention training. The overarching goal of this training initiative is for Denver's first responders to enhance their current knowledge, attitudes, and skills required to quickly recognize and effectively respond to emotional and behavioral crisis incidents involving psilocybin and other psychedelics. MAPS has been working in close collaboration with City and County of Denver department leads of these named departments to ensure the value of the services they deliver in the trainings will be in alignment with the goals set forth by the panel and by the City and County of Denver. MAPS has been tasked with training development and has committed considerable staff and financial resources to date to develop this curriculum. As of November 2021, training and development is proceeding into the pilot phase of the training, pending contract finalization with the city. MAPS has submitted a statement of work to the City Attorney's Office, which is currently under review for incorporation into a contractual agreement between MAPS and the Department of Public Safety. During pilot development, elements of project scope have been identified, including specific departments that we will be training, projected number of city responders to engage in the first round of pilot training, and the projected number of responders that would be trained in full-scale implementation. MAPS is committed to the development and funding of the emergency responder trainings through phase 1 pilot completion. Full-scale implementation across all departments includes approximately 4,000 personnel. The strategy is to be assessed by MAPS in collaboration with the identified departments and the panel post-pilot completion after evaluating the initial pilot results and feedback. Implementation, full-scale implementation strategy discussion will include timeline, projected cost, and potential funding sources. Recent surveys indicate that individuals are using psychedelics now more than ever, and this use spans all age groups. This increased use is accompanied sometimes by a lack of informational campaigns. The absence of such information combined with a growing number of first-time users could increase possibly the incidence of psilocybin-induced crisis, which could in turn warrant deployment of first responders. Psilocybin is a substance with many potential therapeutic and healing benefits, which is why we're standing here today, post-decriminalization. And as with any psychoactive substance with psychological effects, it is best integrated into our community and society with care and intentionality, and thus we are taking a proactive public health approach grounded in information and education. Thank you.
Thank you, Sarah. And so the first meeting that we had with members of the city government after our campaign was successful in 2019 was with then Director of Public Safety, Troy Riggs. And Troy very emphatically told me, he said, "Kevin, we're not concerned about mushrooms in Denver. It isn't really already an enforcement issue, and we may become concerned if there is more criminal activity or more crime related to the decriminalization of psilocybin." And so looking back across the last just about 20 months since we've convened the panel and to the 2.5 years since the law was actually passed here in Denver, we can see from the arrests and the safety data and the use data that the sky, in fact, has not fallen with psilocybin decriminalization. For example, arrests for psilocybin are down by approximately 50% when compared to previous years. And a majority of those arrests, 89%, involve other illicit substances. There are currently no data from Denver hospitals for any emergencies related to psilocybin, although psilocybin is in the ICD-10 as a diagnosis option for emergency personnel. Traditionally, psilocybin, and still to this day, accounts for less than 1% of drug felonies and misdemeanors in Denver, which is similar to the national average, which is also less than 1%. And then according to our observational data, both from an organization that we've worked with called Unlimited Sciences, and also the Global Drug Survey. Observational data, looking at use outside of clinical settings or use outside of highly structured university-level therapeutic settings, indicates that psilocybin is used intentionally in an informed manner by most people for reasons of health and mental wellness. And the last thing that Mr. Riggs said to me is that, Kevin, what we actually are concerned about here in Denver is that 50% of our inmates here in the city and county of Denver have mental or behavioral health issues, but they're not getting the treatment they need because they're behind bars. And then he said, what can you do to help? And it honestly shocked me because I was expecting to go into the room and have a conversation about psilocybin, and it very quickly turned into a conversation about Denver's drug enforcement policies and how are we treating individuals to make sure they can heal. And so with that, our recommendations are a first step in terms of what can we do. And so the first recommendation that we have for the City Council is that we recommend that we train City and County of Denver first responders, including all active first responders within the Denver Police Department, Denver Sheriff Department, Denver Paramedics, Denver Mental Health, Denver Fire Department, and STAR program to maximize public and officer safety while minimizing liability through specific instruction regarding appropriate recognition and response to persons undergoing psychedelic crisis. The second recommendation, as it's related to the multi-responder training, is to continue to collaborate with MAPS on development and implementation of psilocybin harm reduction training. And the third recommendation for the multi-responder training is to consider resource, timing, staff, and financial implications of the post-pilot rollout of the project across over 4,000 City and County of Denver first responders. We're recommending that the City and County of Denver produce co-branded educational public service announcements and programs in Denver to educate the public regarding psilocybin use and access to harm reduction services in the city. We're recommending that the city creates a data collection and reporting system for law enforcement, paramedics, hospitalizations, and emergency rooms for any interactions involving psilocybin, and this is for ongoing public safety monitoring. We are recommending that the City and County of Denver make the sharing and gifting of psilocybin mushrooms also among the lowest law enforcement priority. And we're also making the recommendation that the communal use of psilocybin is also among the lowest law enforcement priority. We would like to expand voting members of the Denver Psilocybin Mushroom Policy Review Panel to promote inclusivity and better reflect Denver's diversity. And finally, our last recommendation is that we would like to determine how psilocybin therapy can be applied to address mental health issues in Denver. And in conclusion, and talking about next steps. So Colorado is the 47th worst ranked state in the US in terms of adults with mental health issues and access to mental health services. Denver is no exception, with an incredible increase in suicidality and depression, especially during COVID-19. So it's clear that we need alternative, effective treatment options for individuals, especially for those who are looking at major diagnoses. So at this point, Denver has an incredible opportunity to continue to be a leader across the nation in terms of drug policy reform, but especially from the perspective of being a national beacon for health and mental wellness, and the opportunity to create new policies that reduce harm, enable self-governance, and create access to more effective healing options. And so over the coming months, we'll be working with the city to finalize the multi-responder training and potentially consider a new resolution that incorporates this panel's recommendations. Thank you very much. And at this time, we're prepared to take questions.
Thank you, Kevin. We had posted public comment, but nobody signed up, so.
We have one person who would like to speak, if that's okay.
All right, well, if it's one person, sure, let's go ahead, and then I have Councilman Hines up. So please introduce yourself and we give our speakers 3 minutes.
Thank you, council folks. Nice to be here. Sean McAllister, a member of Councilwoman Sawyer's district. I was also secretary on the psilocybin review panel. I just want to stress a couple things. All the recommendations are important. We look forward to a conversation with council in the coming months to consider if the council will take up these reforms and implement them. But I want to stress that other cities have taken up the call that Denver started in 2019 and really gone farther than the city of Denver. Oakland followed Denver's initiative in May of 2019 by decriminalizing all psychedelics and decriminalizing a broader array of activities around psychedelics, including sharing without compensation. That was followed by Santa Cruz, by Ann Arbor, by Washington, D.C., now by the city of Detroit, by the entire state of Oregon, which last November legalized therapeutic use of psilocybin mushrooms. The state of California has taken up a broad decriminalization initiative of 7 different psychedelics that passed the entire body of the legislature last year and is set to potentially pass the legislature in 2022. So I just want to encourage the council to take a hard look at these recommendations and see how other places have been leading the way. And we want Denver to catch up. And part of that catch up is that the social sharing recommendation right now in Colorado, it's a felony if a person shares any amount of psilocybin mushrooms with a friend or a family member, even if that friend or family member is a veteran with severe PTSD that could, benefit from psilocybin. That is a felony. And in the city of Denver, we had Beth McCann on our panel, and we had nice assurances that they didn't intend to pursue cases like that, but technically the decriminalization does not cover that sharing among friends without compensation. And these other cities and states have gone to that level. So we would ask you to take a hard look at that issue. There are no clinical trials available for a veteran with PTSD for psilocybin in Denver. So the only way someone would get it in the city of Denver, unless they grow it themselves, is through a friend or family member sharing. And so I think that is a critical expansion of the protections in I-301, and we hope you'll adopt those yourself. And we look forward to a conversation about that issue in the coming months. Thank you.
Thank you. Councilman Hines, you're up next.
Thank you, Committee Chair. So let's talk about why we're here. The reason we're having this conversation in this report today is because of Initiative 301 passed in May of 2019, right? So this report is required based on what the people voted on with Initiative 301. Is that correct?
That's correct.
Okay. How many people, let's because we're in Denver and this is a Denver body, let's limit it to Denver. How many people have died from psilocybin overdoses in Denver?
0 or not reported.
So over all time, we've not had any reported deaths from psilocybin overdoses.
Not that we know of that's directly related to consuming psilocybin mushrooms.
Okay. How many people have injured or killed others under the influence of psilocybin?
Again, it's a very rare circumstance. There aren't any known reports of individuals here in Denver who have injured or killed a person while under the influence of mushrooms. I would like to note that in terms of a lethal dose, Councilman, there is no known lethal dose for psilocybin. In fact, it's assumed that a person would have to eat pounds of psilocybin mushrooms in order to experience toxicity that results in fatality.
What about the effects of psilocybin decriminalization? See, it trips me up too. Has that led to an increased strain on our police or judicial system?
Not that I'm aware of. According to the data that we've collected, as I mentioned briefly in our report, arrests have been cut in half in comparable years. And it doesn't seem, as our panel had unanimously agreed upon back in March, that decriminalizing psilocybin here hasn't presented any significant public health or safety issue in the city.
Okay. What about the medical research that's been completed in the last few years about psilocybin? Are there medical journals that are reporting health benefits or anything along those lines regarding psilocybin?
Absolutely. In fact, it's very easy to do a Google search or a DuckDuckGo search and just type in psilocybin research. And so there are a number of clinical trials that have been published in journals from the NCBI, from the NIH, research coming out of universities like Johns Hopkins University in Baltimore. There is a tremendous amount of research that's been conducted over the past 20 years here in the US.
And that John Hopkins research, that was in 2018, is that right?
Well, Johns Hopkins has conducted multiple clinical research with psilocybin mushrooms, and they're still continuing research to this day. But Johns Hopkins has conducted research in 2018. They conducted research in 2016, I believe, all the way back to 2004, if I'm correct. And most recently, the research coming out of Johns Hopkins, at least in 2018, and again in 2019, is showing the efficacy of psilocybin as a potential treatment option for major depression or treatment-resistant depression. And these studies, again, as I mentioned earlier, Councilman, not just here in the States, but also overseas at places like Imperial College London and other universities as well.
You said this in your introduction, and you said it again just a minute ago, but I want to drive it home. How many, or what was the committee vote regarding accepting this report?
9 yes, and 1 member who did not vote.
So unanimous.
Unanimous, yes.
And that report includes recommendations, including decriminalizing sharing personal amounts, the education for first responders, and a whole host of things that you've described. That unanimous vote also covers the recommendations for implementation. Is that correct?
That is correct. Yes, sir.
And talking about those members, the membership of the panel, it includes representation from the police department, fire department, DA McCann herself, me, you, some advocates on for psilocybin, but we have a broad spectrum of public safety and the legislative branch and the judicial, or their district attorney represented. Is that right?
That's correct. Our district attorney, a member of our city attorney's office, a division chief with the Denver Police Department, a captain with the Denver Sheriff's Department, yourself, sir, and of course we have 2 proponents of our campaign, in addition to other health professionals and attorneys who are represented on the panel.
Okay, thank you. It looks like there are a couple people after me, so should there be time, I'll come back. Thank you, Committee Chair.
All right, great. Next up is Councilwoman Kniech.
Thanks very much. I think Councilman Hines might have answered my first question, which is I'm looking at your bylaws for the panel, and it states 2 council members, and I didn't know who that was. Are you one of them, Councilman Hines?
I am both of them.
Okay, got it. A man who can fill 2 sets of shoes. That's great. Anyway, there is not a list of the members in the report, nor is there a list on the website. So I would ask that we get that. And then I don't see that there's anyone from public health involved. And so am I correct? Our Denver Public Health?
Not currently.
Okay.
No.
I think if you are going to expand, I'd love to see them included. I guess the one question I have is I appreciate the focus on the spiritual history and the clinical use, but I feel like we've skirted a little bit around the idea of recreational use or solo use that's not under the supervision or collectivity with anyway. So, and I think criminalization has not been highly successful as a drug strategy. So just know that I'm not trying to catch you here. But I do want us to have a sincere conversation about other things than just the benefits. And so can you talk to me about why we kind of circled around the recreational or solo use? And I am familiar with cases in other states of individuals who took their lives while under the influence. And so talk to me about that harm reduction strategy.
Thank you. Well, so I think first of all, in terms of a harm reduction strategy, it's critical that this city is working with local community stakeholders and organizations to actually create educational materials so the folks understand how to safely and responsibly use psilocybin mushrooms. Councilwoman, I would argue that yes, there are certainly folks who have used psilocybin recreationally, I just so happen to be one of those people in the past decade or so. But I would say that according to the most recent data that we have, at least from people that we're willing to share observationally, is that yes, a majority of folks, what may be considered recreational on the outside can actually be incredibly therapeutic to the person undergoing the experience. And sometimes that doesn't necessarily look like it's in a clinical setting. It might be in the comfort and safety of a person's home. And so while we do understand that there certainly has been, is, and will be recreational use with psilocybin mushrooms, and frankly, many other substances, we do feel that, given the safety profile of psilocybin, that both the city government and the residents of the city and county of Denver can feel a little more comfortable, moving forward, expanding civil liberties with mushrooms. And especially I think if we're considering, if we're going to go out on a limb here and consider a comparison between psilocybin use and alcohol abuse, I think there's a very distinct difference there. And from what we understand is that, for the most part, when combined with, education and the right information, folks can use psilocybin safely.
All right, I'll leave it there. I would just ask that we have to continue to talk about all forms of use, not just the spiritual and clinical use. We have to be talking about that other type of use that is occurring when we do this work on this panel. I think that's just really important. So thank you.
I can add to that. Oh, okay. Can I just say that the whole harm reduction training, that's what that's addressing is recreational use. Yeah.
All right, thank you. Councilwoman Ortega?
Thank you, Madam Chair. I was going to raise some of those same questions that Councilwoman Kinich already elaborated on, so I don't need to go into any detail. I just think that as we have a committee and a panel that is missing the public health voice, I just think that's absolutely an essential part of the big picture conversation about this. So I would just advocate for the same and agree that the personal use and how and where people get it, all of those things I think are an important part of the conversation. Thank you.
All right, Councilman Hines, would you like to wrap up the conversation, please?
Thank you, Committee Chair. I don't have any other questions, but I would say that that this committee met for over a year, and I recognize the importance of adding the public health voice to the conversation. I think a lot of the conversation was about, as you mentioned, some of the holistic benefits, but a lot of the conversation in the panel was also about public safety, public health, safety, and welfare, and so making sure that we had representation from the branches of public safety was important, so that we could investigate some of the negative effects and strain on our criminal justice system, and there was nothing there. So thank you to the panelists who are here. Thank you for everyone who's come to watch the presentation. I am very interested in getting the public health perspective formally, because I've already reached out informally, but I don't want to step on their toes with an informal statement. But I'm really excited about how Denver was the leader in our nation, and thanks to you and the many people who helped us decriminalize psilocybin in 2019. I am very interested in continuing to move forward if it makes sense. And based on all the report recommendations, it does seem to make sense to me. Thank you, Committee Chair.
Thank you, Councilman Hines. Thank you all for being here. Thank you for all of the work you've done and for this very comprehensive report. And we look forward to learning more. I have a couple of questions I'm going to ask you, but I'm going to email them to you. But thank you, everyone. I know we had a very condensed time frame for you today, but we just have an awful lot on our agenda this time of year. But we really appreciate you being here, so thank you.
Thank you, Madam Chair. And thank you, council members.
All right, and with that, this meeting is adjourned.